Navigating in the complex environment of allergy is a frequent challenge for many physicians. In the course of the 90s, the prevalence of allergy has been widely recognized. Often, the early visible symptoms are the ones that first come to be noticed. However, there is much more to allergy than these early visible symptoms. So today, we invite you to explore its underlying inflammatory process, which plays a crucial role in the chronicity of allergy. To get a closer look at this subject, let's travel to the heart of the allergic cascade shortly after an allergen provocation. Histamine flowing around has triggered several key mechanisms. Sensory nerve endings are stimulated, and these will trigger the familiar itching and sneezing symptoms. If we continue to travel, we now can see on these surrounding blood vessels histamine, which is stimulating smooth muscle cells. The resulting vasodilation and edema enables plasma proteins and immunoglobulins to diffuse from the blood vessels into the tissues. Now inside the blood vessel, we can see eosinophils, which are very aggressive inflammatory cells. Eosinophils become activated and adhere to the endothelial cells. Eosinophils will then migrate from the blood vessel, where they will cause tissue damage. This is what is called allergic inflammation. But what made this migration of eosinophils possible actually occurred inside the blood vessel. The adhesion and migration of eosinophils happened as a result of the expression of adhesion molecules on endothelial cells and on eosinophils. To understand what triggered this central mechanism of the allergic inflammation cascade, let us enter into one of these cells where it occurs. If we pass through the cell membrane, we can now see the cell nucleus. This agent penetrating into the nucleus is a crucial factor of our process. It's called nuclear factor kappa B. Nuclear factor kappa B, once activated, will trigger in the cell nucleus a chain of reactions, leading to the production of the pro-inflammatory mediators. Nuclear factor kappa B has been recognized as a crucial factor of the allergic inflammatory cascade. But, most importantly, it has now been identified that this nuclear factor kappa B is itself indirectly linked to H1 receptors, meaning its activity may be influenced by H1 receptors.
Now, I know that you all know well about the effects of antihistamines in relieving some of the symptoms of allergic rhinitis, particularly itchy nose, itchy eyes, runny nose, and sneezing. But what I hope you are beginning to learn from this film is that antihistamines also have some anti-inflammatory actions. The first clues we had to such effects was when it was realized that antihistamines are able to down-regulate adhesion protein expression. Now, adhesion proteins are found on the cells that line the blood vessels, and they're involved in the capture of eosinophils from the bloodstream prior to the migration into the tissues to cause allergic inflammation. With the recent discovery of the linkage between the H1 receptor and NF-kappa B, which is involved in the synthesis of adhesion protein expression, we are beginning to understand how antihistamines may relieve allergic inflammation.
All these current investigations and recent findings have a very important outcome. They confirm the importance of the H1 receptor, which appears more than ever as an important target of anti-allergic treatment. This could influence not only the early symptoms, but also the late-phase allergic inflammatory mediated symptoms. This new data also confirms that the potency of H1 antagonists is critical, as they really target the cornerstone of the whole allergic cascade and its related symptoms. The more potent an H1 antihistamine is, therefore, the more likely that it will downregulate the allergic inflammation. However, further investigations on H1 antihistamines, mainly on enantiomers mixture, has also demonstrated that their inhibitory potency on H1 receptors could be improved. This was one of the aims behind the development of a new antihistamine with anti-inflammatory properties, Xyzal. Xyzal's powerful, selective, and long-lasting binding to the H1 receptor offers a potent antihistaminic activity. This can also lead to reduction of the pro-inflammatory mediators through downregulation of nuclear factor kappa B. As a consequence, the expression of adhesion molecules on the cell wall is decreased, vascular permeability is reduced, and migration of inflammatory cells such as eosinophils is downregulated. So, with the treatment acting effectively on the underlying inflammatory process of allergy, one can now expect fast patient satisfaction and relief of allergy symptoms. Xyzal, an exciting treatment with proven pharmacological, pharmacodynamic and clinical potency, will offer fast and effective symptom relief to your allergic patients.